next topic, we are very lucky to have Dr. Ahmad Khaldun Ismail. He will talk about the regional collaboration on clinical toxinology moving across nations. Good afternoon, sir. He is the founding consultant and advisor of Remote Envenomation Consultancy Services. He is the founding director and advisor of the ASEAN Marine Animals and Snakes Envenoming Poisoning Management. He is also a member of the WHO Global Roster of Experts and Technical Advisory Group on the Prevention and Control of Snakebite and Venoming. And he is also the founding advisor of the Clinical Toxinology Special Interest Group of the College of Emergency Physician in Malaysia. Good afternoon. Please give a round of applause to Dr. Ismail.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and very good afternoon to everyone. Thank you again for inviting me to beautiful Philippines. I've been to this beautiful country several times before this, and we have very, very good friends here who is also part of the team that helped me build clinical toxinology in the region. So let me begin with an overview of what clinical toxinology is all about. It's basically a subspecialty of toxicology as we know it, but as we move away a bit from toxinology in general, basically clinical toxinology involves all the naturally occurring toxins. That is mainly from plants, mushroom, animals, both in the sea and on land, and also bacteria. But we don't deal with bacteria. We don't want to be in conflict with our those who deal with infectious diseases. So basically, it is still a very, very young subspecialty, as if you like. In our fraternity of emergency medicine, it was really unheard of before 2015, but the movement of making clinical toxinology a subspecialty or a subspecialty of clinical toxicology has been for a long time before this. So what really drives us in this region to look into clinical toxinology is the problem, as we have heard from Dr. Maha, from Dr. Miat, and also maybe from Cambodia after this, is on snake bite or snake-related injuries. But there are many other animals or causative causes that produce toxins, such as in the form of poison or venom in our tropical ASEAN, that is also, I think, a bit neglected. And that's where we feel this subspecialty of clinical toxinology will help address those issues. In terms of regional networking, as Dr. Maha showed just now, there's so many, how should I say, areas that needs to be addressed. And this can, I think, be addressed by your own country, but we feel that in ASEAN, we have to share resources, we have to be supportive with each other, we have to share ideas, and I think today, or actually this conference, helped to highlight that collaborative opportunities. So we have been working in terms of making clinical toxinology, or to highlight clinical toxinology from various angles. And that includes forming what we call associations or societies that deal with toxinology, and also in terms of supportive clinical support for our healthcare providers. So this has been ongoing. I think tomorrow is going to be a big step for Philippines, where we will officiate the launching of the Philippine Society of Toxinology. So, of course, throughout the years, as we, something new, when we launch, it has a lot of so-called challenges. But because of that, also, we can actually create more achievements. So, and this needs to be highlighted and also look at how we can improve further in terms of future directions. So, when, where, and how did I get into this area? So, as you can see up front, this handsome-looking gentleman, he has been my inspiration from the beginning when I was just a young, or probably younger, still young, emergency physician, as I was doing my master's in emergency medicine in Malaysia. He was my coach at that time. So he used to say to me this quote, which is very important, I think, to me at least: be a patient's advocate. If we are doing it for the sake of ourselves, we may win, we may lose. But if we fight for our patients, okay, we will always win. Okay, so this is the motto that I use, or should I say, hope that all the efforts that we do in clinical toxinology is going to be based on. We don't work for ourselves, we work for our patients. And that's why in this area, and I know many of us in this region knows also, in the area of clinical toxinology does not make much money. There's not much money in there. But we have to address the issue for the sake of our patients. And as we move along, this gentleman became my mentor, still is, and now also my sponsor. I will not disclose how much he pays me every month, or I have to pay him every month. I just pay with coffee, maybe. Okay, so in terms of collaboration, as I said, I just introduced you a little bit just now. The development of clinical toxinology is not really just from one person or one country. We started off already having collaboration very much early on, even before the birth of so-called clinical toxinology in this region. So it started with one person, yourself. Okay, and if you can see from this graph, if you work on yourself, it's going to be, you're going to carry so much burden above you, right? But if you look at more than just yourself, you start to build relationships or networking with your own colleagues in your own country, which is your indigenous problem. You can perhaps have more people to help carry, and therefore the burden is going to be less. And as we go further than our own country, we look at collaboration in the region. Who are the people interested in the topic, and where they are, we can actually help to carry the burden for our patients, and the burden is going to be much lighter. And also, of course, here is the so-called graphic flow of how we have developed. Back in 1992, in this region, there's only one society on toxinology, which is Malaysian Society on Toxinology. And I only joined this society back in 2013. So that is very young. So from 1992 to 2013, the society was not really that active and not involving clinicians. So from 2013, before 2013, in 2012, a group of emergency physicians in Malaysia decide to help our clinicians in providing the appropriate treatment to our patients in terms of clinical toxinology, such as snake bites mainly, and other venomous animals. And from then, we developed another platform to disseminate information and sharing information of what we, a symposium, what we call ASEAN Marine Animal and Snake Envenomation Management. And from there, we have now opened up our scope from just being a national so-called society or body to become more regional. And therefore, from 2013, we have admitted other than Malaysians into the society, and from there we generate interest and we support for them, and we form another, or should I say other, inspired other countries to also form their own toxinology society. So Philippines is our latest so-called member in terms of toxinology in ASEAN. So in terms of national collaborations, from Malaysian perspective, we need to form both from the institutional side and also from the public, so our NGOs. So in terms of our institutional, we have established institutions which so-called collect data and also provide services. The Ministry of Health, Ministry of Education, Malaysian Biodiversity Information System, and the National Poison Center. And on top of that, we also provide networking and support to our so-called non-governmental organizations, such as the special interest group on snakes, some pre-hospital care services, and also even in the social media. This morning, we heard Dr. Miat talk about how social media, Facebook in Myanmar, plays a role. So that is what we have actually been doing in supporting, providing them with proper information, accurate information to disseminate to the public. So in terms of international collaborators, we have, of course, the WHO, and of course, WHO at the moment dealing with snake bite, which recognize it as one of the neglected tropical disease. But the Westpac, we have a collaboration with them in terms of jellyfish. So this is our current ASEAN connection at the moment, and today we are happy to announce that Cambodia has managed to join us as well in the region, and the only country in that map that is still missing a representative for Rex ASEAN is Singapore. I'm working on it. Okay, so how do we translate it into our own country's information definition of information we get from the appropriate sources, and we create our own. It's important, as Dr. Maha mentioned just now, Dr. Miat said, every country is different. They have different species of animals, they have different problems and also protocols for health management. So we come up with individual countries' protocols. So Dr. Maha was saying just now, they will be having a new guideline for Indonesia, which is appropriate because they have different species than Malaysia. So we started first, we showed the way how to go. We have our own national guideline, and then we have supportive guideline both for healthcare providers and also for the public. Okay, so on terms of educational program, needs to be ongoing. It cannot be just left with guidelines or pamphlets. We need to be actively involved with the public and also for our healthcare providers in keeping them to be updated with all the new information as we go along with our research. So there are many courses that we have provided which involve not just for healthcare providers but also for the public. Down to the level of just to explain the difference between poison and venom. Okay, we had a 30 days exhibition in the National Museum just to explain what is poison and what is venom. So that was like, very basic. Okay, so in terms of research and development, I think this is more relevant for us here today. We have to look at these areas in terms of community engagement, health system, safe, effective treatment antidotes, treatment and recovery process, and also global collaborations. So we have done over the years some collaborative research in this region where we open up in terms of the number of countries involved in the studies and also networking between our own institutions. So there are many institutions, for example, Ministry of Health and Ministry of Education combined together with National Poison Center to come up with research output. So some of them received what we call funding. The one that we had before was from the Wellcome Trust, which support us over the past 3 years for our research on antivenom in the region. In terms of community engagement research, as I said just now, we have already a few things that we give to the public in terms of publication, but we also can do in terms of what Dr. Prof. Gabriel presented this morning regarding on how the community react to what we call safety-seeking behavior and health-seeking behavior. So on top of that, we also come up with new guidelines or what we call protocols for the hospitals to be used. And also in terms of emergency medicine, we've already renewed the previous chapters, which is already far, far outdated. So it's very important for us to actually look at all our so-called textbooks in terms of emergency medicine, for example, for us here in pediatric protocols, to update them with the appropriate information. Okay, so I think in terms of my last couple of slides, we have to recognize there is a problem in the region. We have to recognize also the efforts that is being put forward in terms of dealing with this issue. And in Malaysia, I have to announce that this year, earlier this year, we have our College of Emergency Physicians has finally recognized clinical toxinology as one of our special interest group. And that is a big boost to all our efforts, and hopefully for future, we may consider what we call ASEAN Fellowship in Clinical Toxinology. It is in the works, and we're hoping our fellow colleagues in Philippines will take this up further to materialize our dream of having the ASEAN Fellowship in Clinical Toxinology. So before I end, I just want to share with you a bit but word of wisdom. When a man dies, his deeds come to an end, except for three things, which is continuous charity, a knowledge which is beneficial, and virtuous descendants. And for us, who doesn't have children, is also our students. Okay, with that, thank you.